High blood pressure or hypertension is called the silent killer for good reason. It often has no symptoms but is a major risk for heart disease and stroke. Here are the 17 effective ways to lower your blood pressure levels. Number 1. Increase activity and exercise more. As you regularly increase your heart and breathing rates, over time your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lowers your blood pressure. Increasing your activity level can be as simple as using the stairs, walking instead of driving, doing household chores, gardening, going for a bike ride, and playing a team sport. Just do it regularly and work up to at least half an hour per day of moderate activity. Number 2. Lose weight if you're overweight. If you're overweight, losing even 5 to 10 pounds can reduce your blood pressure. Plus, you'll lower your risk for other medical problems. Number 3. Cut back on sugar and refined carbohydrates. Many scientific studies show that restricting sugar and refined carbohydrates can help you lose weight and lower your blood pressure. Number 4. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. Potassium is a double winner. It lessens the effects of salt in your system and also eases tension in your blood vessels. However, diets rich in potassium may be harmful to individuals with kidney disease, so talk to your doctor before increasing your potassium intake. It's easy to eat more potassium. So many foods are naturally high in potassium. So here are a few. Low-fat dairy foods such as milk and yogurt, fish, fruits such as bananas, apricots, avocados, and oranges, vegetables such as sweet potatoes, tomatoes, greens, and spinach. Number 5. Eat less processed food. Most of the extra salt in your diet comes from processed foods and foods from restaurants, not your salt shaker at home. Popular high-salt items include deli meats, canned soup, pizza, chips, and other processed snacks. Foods labeled low-fat are usually high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. Cutting down on, or even better, cutting out processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood pressure. Number 6. Stop smoking. Stopping smoking is good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation and narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels even if you're around secondhand smoke. A study showed that children around secondhand smoke in the home had higher blood pressure than those from non-smoking homes. Number 7. Reduce excess stress. We live in stressful times. Workplace and family demands. They all contribute to stress. Finding ways to reduce your own stress is important for your health and your blood pressure. There are lots of different ways to successfully relieve stress, so find what works for you. Practice deep breathing, take a walk, read a book, or watch a comedy. Listening to music daily has also been shown to reduce systolic blood pressure. A recent 20-year study showed that regular sauna used to reduce death from heart-related events. Number 8. Try meditation or yoga. Mindfulness and meditation, including transcendental meditation, have long been used and studied as methods to reduce stress. Yoga, which commonly involves breathing, control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. Number 9. Eat some dark chocolate. Yes, chocolate lovers. Dark chocolate has been shown to lower blood pressure, but a dark chocolate should be 60 to 70% cacao. A review of studies on dark chocolate has found that eating 1 to 2 squares of dark chocolate per day may help lower the risk of heart disease by lowering blood pressure and inflammation. A 2010 study of 14,310 people found that individuals without hypertension who ate more dark chocolate had lower blood pressure overall than those who ate less dark chocolate. Number 10. Try these medicinal herbs. Herbal medicines have long been used in many cultures to treat a variety of ailments. Some herbs have been shown to possibly lower blood pressure. Always check with your doctor or pharmacist before taking herbal supplements. They may interfere with your prescription medications. Here's a partial list of plants and herbs that are used by cultures throughout the world to lower blood pressure. Number 11. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. For some people, getting a good night's sleep isn't easy. There are many ways to help you get restful sleep. Try setting a regular sleep schedule. Spend time relaxing at night, exercise during the day, avoid daytime naps, and make your bedroom comfortable. The National Sleep Heart Health Study found that regularly sleeping less than 7 hours a night and more than 9 hours a night was associated with an increased prevalence of hypertension. Regularly sleeping less than 5 hours a night was linked to a significant risk of hypertension long term. Number 12. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. According to one clinical study, a time-release garlic extract preparation may have a greater effect on blood pressure than regular garlic powder tablets. Number 13. Eat healthy, high-protein foods. A long-term study concluded in 2014 found that people who ate more protein had a lower risk of high blood pressure. For those who ate an average of 100 grams of protein per day, there was a 40% lower risk of having high blood pressure than those on a low-protein diet. A high-protein diet may not be for everyone. Those with kidney disease may need to use caution, so talk to your doctor. It's fairly easy to consume 100 grams of protein daily on most types of diets. High-protein foods include fish such as salmon or canned tuna in water, eggs, poultry such as chicken breast, beef, beans and legumes such as kidney beans and lentils, nuts or nut butter such as peanut butter, chickpeas, cheese such as cheddar. Number 14. Take these BP-lowering supplements like omega-3 polyunsaturated fatty acid, whey protein, magnesium, coenzyme Q10, or citrulline. These supplements are readily available and have demonstrated promise for lowering blood pressure. Number 15. Drink less alcohol. Alcohol can raise your blood pressure even if you're healthy. It's important to drink in moderation. Alcohol can raise your blood pressure. Moderate drinking is up to 1 drink a day for women and up to 2 drinks per day for men. Number 16. Consider cutting back on caffeine. Caffeine raises your blood pressure, but the effect is temporary. It lasts 45 to 60 minutes and the reaction varies from individual to individual. Some people may be more sensitive to caffeine than others. If you're caffeine sensitive, you may want to cut back on your coffee consumption or try decaffeinated coffee. The choice of whether to cut back depends on many individual factors. One older study indicated that caffeine's effect on raising blood pressure is greater if your blood pressure is already high. Number 17. Take prescription medication. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs. They work and will improve your long-term outcome, especially if you have the other risk factors. However, it can take some time to find the right combination of medications. Talk with your doctor about possible medications and what might work best for you. So love yourself enough to live a healthy lifestyle. If you like this video, please hit the like button. And if you have any suggestions for the next video, I would love to hear it in the comment section below. If this video helps you, share it with your friends and family. And please subscribe to the Healthy Happy Life for more updates in our upcoming video.